everyone, welcome to my channel. Today I am going to deal with the topic that is terminologies in nursing. So these are the basic terminologies which we use in our nursing. So first is pyrexia, that is increased body temperature above the normal, that is 98.6 degree Fahrenheit or 37 degrees Celsius. Then blood pressure, that is amount of pressure exerted by blood on the wall of arteries. Pulse, that is the rhythmic expansion of arteries from the heart's beat felt at points like the wrist or etc. Respiration, it is the process of gas exchange, that is oxygen in and carbon dioxide outside between the body and the environment. There are types of respiration. There are inspiration and expiration. Inspiration is nothing but the inhalation of the oxygen inside the body, and expiration is nothing but the exhalation of the carbon dioxide outside the body. So there are some of the basic terminologies which are been discussed here related to the system wise, so that it will be very useful for you to keep in mind and remember for a long time. They are the first system we take here is cardiovascular system. In cardiovascular system, first is heart rate. What is heart rate? It is nothing but the number of heartbeats per minute. What is cardiac output? The amount of blood pumped by heart per minute is known as cardiac output. What is tachycardia? That is increase in the heart rate above 100 beats per minute is known as tachycardia. What is bradycardia? Decrease in the heart rate, that is less than 60 beats per minute is known as bradycardia. So what is hypertension? That is increase in the blood pressure, that is above the normal, that is 140/80 mm of Hg. What is hypotension? That is decrease in the blood pressure, that is known as hypotension. Edema. What is edema? Swelling due to fluid accumulation. What cyanosis? Cyanosis is nothing but the bluish discoloration of the skin or the due to the lack of oxygen. Next system is respiratory system. In this, what first is dyspnea, that is difficulty in breathing. Tachypnea, that is rapid breathing. Bradypnea is slow breathing. Apnea is absence of breathing. Cough, it is nothing but a protective reflex to clear the airway. Hypoxia is low oxygen level in tissues. Hemoptysis, that is blood in sputum. So next is the nervous system. In nervous system, we will see the consciousness. Conscious is nothing but the awareness of surroundings. Unconscious is nothing but lack of awareness. And LOC is the nothing but the abbreviation level of consciousness. And reflex. What is reflex? That is automatic response to stimuli. So paralysis, what is the meaning of paralysis? That is loss of muscle function. Paresis. Paresis is nothing but a partial paralysis. Seizure. Seizure is nothing but sudden abnormal brain activity. Then coma. Coma is nothing but deep unconsciousness state. So next, coming to the next system, that is blood or hematological system. In this, we know that deal with the anemia. Anemia is nothing but the decreased Hb count is known as Hb, nothing but hemoglobin count is known as anemia. Polycythemia, that is increased red blood cell count. Leukocytosis is nothing but increased WBC, that is white blood cell count. Leukopenia is decreased the white blood cell count. Hemorrhage, nothing but excessive bleeding. Clotting, nothing but formation of a blood clot. Thrombosis. Thrombosis is nothing but blood clot inside the vessel is known as the thrombosis. So next system is the digestive system or the gastrointestinal system. So in this, first is ingestion. Ingestion is nothing but the intake of food. Digestion is nothing but breakdown of food. Absorption is nothing but the uptake of nutrients. Anorexia. What is anorexia? It is nothing but the loss of appetite. Dysphagia, nothing but difficulty in swallowing. Dyspepsia is indigestion. Nausea. What is nausea? It is nothing but a feeling of vomiting. Vomiting. What is vomiting? That is expulsion, forceful expansion of the gastric contents. Diarrhea. Diarrhea is nothing but the frequent loose stools. Constipation, that is difficulty in passing the stool. So next system is the urinary system. In this system, the main terminologies are urination, or that is maturation, which is known as passage of urine. Oliguria, that is scanty urine output. Anuria, that is absence of urine. Polyuria, that is excessive urine output. Polydipsia, that is excessive thirst. Polyphagia, that is excessive hunger. This polyuria, polydipsin, polyphagias are found in disease condition, that is diabetes mellitus. These are the three main symptoms there. Hematuria, that is blood in urine. Dysuria, that is painful urination. And then incontinence, that is involuntary urine loss, that is not in our control. Retention, that is inability to pass the urine. So next system is the endocrine system. In this, hormone. What is hormone? Hormone is nothing but the chemical messenger in our body. Hyperglycemia. What is hyperglycemia? It is increase the blood sugar level. Hypoglycemia, that is decrease the blood sugar level. Diabetes mellitus. This is a condition which is a disorder of insulin. The main symptom is increase in the hyperglycemia, that is increased blood sugar level. Goiter. Goiter is nothing but the enlargement of the thyroid gland. This is metabolism, that is chemical processes in the body is known as metabolism. So next system is the musculoskeletal system. In this, mobility. What is mobility? That is ability to move freely. Immobility, that is restriction of movement. Atrophy, that is wasting of muscle. Fracture, that is break in the bone. Dislocation. Dislocation nothing but joint displacement. Contracture, that is permanent muscle shortening. Posture, that is body alignment. Gait. What is gait? That is pattern of walking. So next system is the integumentary system or the skin. In this, skin integrity, that is healthy intact skin. Pressure ulcer, nothing but tissue injury due to pressure. Erythema, that is redness of skin. Abrasion, that is superficial skin injury. Laceration, that is cut or tear in skin. Burn, that is tissue damage due to heat. Hypothermia, it is nothing but increase body temperature. Hypothermia, that is decrease body temperature. So the next system is the reproductive system. That is what is menstruation, that is monthly uterine bleeding is known as menstruation. Amenorrhea, that is absence of menstruation. Pregnancy, that is state of carrying the fetus. Gravida, number of pregnancies. Para, number of births per delivery. Lactation, that is production of breast milk. Thank you. Please like, comment and subscribe to my channel.